Hi, my name is Roland Poku. I saw Diaz at this week's clinical rotation, who Diaz is an established patient who was in the office for a 6 months um, follow-up for medication refill and blood pressure recheck. His primary diagnosis is hypertension. He's a 69-year-old male. He's right-handed. Other history that he has is anxiety and depression. And uh, except for some skin rashes that he had on his skin, something had developed about 2 weeks prior to our visit to our office. He has seen a dermatologist who had prescribed Zoloft to try and see if it will help with that itchy and skin on his skin. Otherwise, he's well appearing. Social history: he's a non-smoker and a current drinker. He drinks about 3 cans of beer 3 times per week, in addition to occasional vodka shots. Current medication that he's on, he's just on two blood pressure medications, Losartan, and for which he takes one tablet, 100 milligrams by month once daily, and hydrochlorothiazide 12.5. I take by month once daily. The hydrochlorothiazide was actually prescribed to him today because his blood pressure has been elevated. So um, uh, we decided to add another blood pressure medication to his regimen. He denies fever, chills, endorses occasional fatigue and anxiety. Neurologically, he's intact. Visual acuity is intact, except for some progressive weakness and numbness tingling to his left side. His vision is clear, and there's no neurological issues. He's 5'5" full strength. Denies any hearing loss, sinus pressure, or any visual changes. Respiratory is denies any cough. There's no crackles or rails, and does this occasional shortness of breath. And he denies any chest pain, no edema or palpitations. In the cardiovascular and the respiratory sessions. GI denies any abdominal pain, and he endorses recent diarrhea, denies constipation, nausea, or vomiting, denies dysuria or polyuria. Endocrine, he denies any heat and cold intolerance, and immunology is up to date on his vaccinations. His physical exam, his blood pressure, vital signs are within normal limits. Just except for the blood pressure, we was a little bit elevated. Blood pressure was checked 3 times, an average of 160/82. Otherwise, the rest of his vital signs are normal, and also BMI is a little higher, 25.4. His appearance and his posture, range of motion, and pupils equal, round, and reactive to light and accommodation. Extraocular movements is intact. His eyes, neck, there's no nodules. There's midline, thyroid gland is within normal limits. Long sounds are clear or lows, no wheezing. Adventitious breath sounds, no murmurs, rubs, or gloves. Musculoskeletal range of motion intact, no lower back pain. And neurologically, as I said earlier, it's intact as well. Skin is warm, dry to touch. No lesions, except for lacerations and some skin breakdown because of itching, which is mean itching is skin. There wasn't any labs ordered today. Differential diagnosis for his presenting problems is depression, anxiety, hypertension, and alcohol alcohol abuse. The plan of care includes the medications that we prescribe for him, um, the Zoloft for his skin, and also help with anxiety. And then Losartan, he's supposed to continue to take that once daily, and monitor blood pressure at home, um, and just keep a diary of blood pressure to compare when visiting the next time. Education was provided for him to stay active and reduce salt intake, find salt alternatives, and stay active and check his blood pressure daily at home and find ways to reduce alcohol intake and any activities that will affect his level of blood pressure. There was another place for him to come back to the office in about 3 months' time to repeat a blood pressure check. The CPT code that was used for this visit was 99215. My name is Roland Poku one more time, and this is the end of my presentation.